2025. The Morris County Board of Commissioners will come to order. Please stand for the Pledge of Allegiance. Awesome.
Morning, Mr. Chair.
Morning, everybody.
Morning, Mr. Chair.
All right. Any additions or deletions to the agenda?
So moved.
Motion by Commissioner Wincher, second by Commissioner Moran. Discussions? Hearing none. All in favor signify by saying aye.
Aye.
Opposed? Motion carried. Approval of the consent agenda. Is there anything anybody would like removed for further discussion?
Mr. Chair, I'll make a motion to approve the consent agenda as was provided to us.
Motion made by Commissioner Blaine,
I can second that.
second by Commissioner Casper. Discussions? This will be roll call, gentlemen. Commissioner Blaine?
Aye.
Commissioner Casper?
Aye.
Commissioner Wincher?
Aye.
Commissioner Moran?
Aye.
Myself, Commissioner Lemire, is the aye. Motion carried. So next on the agenda is the Great River Regional Library. Good morning.
Good morning, Commissioners.
Good morning.
Morning.
Have you state your names for the record?
Yes, I'm Karen Ponsack, Executive Director for Great River Regional Library.
Amy Anderson, the Associate Director of Accounting for Great River Regional Library.
And I'm Brandy Cantor, Lead Patron Services Supervisor for Great River Regional Library.
Thank you for your time this morning.
Well, thank you for being here.
Yeah. So Great River Regional Library historically has come to the county twice a year, once at the beginning of the year to talk about library activities, and then following passing of our budget, we come in and talk about how the budget process worked. Great River Regional Library is a 6-county system. We have a joint powers agreement among all the counties and operate 32 libraries and the locker system in Sartell under that agreement. So part of that process is the budget needs to be passed by August 1st every year. So it's always a budget month. Like there's the beginning and the end, and then how you're implementing it, and then we start all over. So at Great River, we have a finance committee. It's comprised of the 6 commissioners on our board, 1 from each county, and then a citizen member. This year, Commissioner Casper represents Morrison County on our board, and on the finance committee, our chair is Jane Dietz, who is from Sherburne County, so she's the citizen member on the board. And that process involves a formula. So there's a 3-part formula. It's based on net tax capacity, the ability for a county to raise funds, the population of that county, and then the actual borrowers from that county. And so when we run through the formula, it's that 3-legged stool, like how much money can your county actually raise for library service, how many people are actually using it, and how many people could potentially use it. So even if we have a flat budget, the formula fluctuates between the 6 counties every year. And I realize this is Commissioner Moran's first time through this, so I apologize if you don't want this much detail. Feel free to rein me in. I can talk all day about this formula. But
No, that's fine.
yeah. So it's an interesting process, and Amy will go into the details of how that process looked this year. But just recognize that even if we have a flat budget, the dollars go up and down between the counties because of the way the formula works. And it's a great partnership that's been in existence since 1969. So we're very appreciative of Morrison County being part of that partnership. On the next slide, you'll see the 5 libraries that actually serve Morrison County directly. We are here in Little Falls. That's our largest library here in Morrison County. It's a great old Carnegie building. Royalton and Swanville and Uppsala and who am I forgetting? Pierce, thank you, sorry. So each city actually provides the building itself, and then Great River's services are administered in the building. So that's the partnership. There's no dollars changing hands between Great River and any of these cities. However, some of the buildings are owned by the city, like Little Falls, and some are actually leased spaces by the city, like Uppsala and Pierce. So all of those relationships are a little different, and they reflect the communities that we serve. So Every type of service is offered in every library. We have an equity of service philosophy, so even if you're Little Swanville, you get the full range of services that you do in Little Falls or even in St. Cloud. But that might look a little different because the copy machine probably can't be the same size, for example. Or in the case of Little Falls, we've received a major bequest specifically for equipment. So we're updating some of the shelving, which isn't something Great River typically provides, but the additional fundraising has allowed us to enhance the services offered there. So if you have questions at the end of the presentation, I'm happy to go into more on how it works, but that's the mechanics of the budget and the process. And we begin that process in January with the full board, and then the Finance Committee starts digging into the details. So we use a base budget process. That means our first look at the budget with the board and the Finance Committee is, what does it cost to do this business exactly the same way next year? And Amy will tell you a little bit more about how that process played out.
Next slide, please. Okay, so this year, our Great River Board adopted its 2026 budget at their July 15th meeting. Morrison County will contribute $528,428 in 2026. This is an increase of $13,082 or 2.54%. Next slide, please. This line graph is an illustration of the county contributions to our revenue budget back to 2016. Morrison County is represented by the maroon line towards the bottom. All signatories in our joint powers agreement are experiencing an increased contribution to 2026 because our library system is reducing the amount of reserves that we're using in our budget. We have used reserves in 3 of the last 5 budget cycles, and we are in the middle of a spend down plan. Next slide, please. The library system's overall budget for 2026 is $10.57 million. This is a flat budget at 0.42% increase from 2025. As I mentioned, we're working through our extended revenue spending and recovery plan. The 2026 budget is using $490,000 of reserves and surplus rollover, as compared to last year where we used $623,000 for that same purpose. Next slide, please. This pie chart breaks down the library system's revenue budget by funding source. Our signatory contributions will make up 72.27% of the 2026 budget. It continues to support the Wi-Fi to Go program, which are hotspots available for patrons to check out on a 1 or 3 week period, and that has been expanded throughout our region. We also will have our summer winter reading and winter reading challenges. Last year, they had over 16,000 patrons participate in those programs. Next slide, please. The organization's 3 largest expense categories are personnel, library materials, and service and equipment contracts. And our remaining expense budget includes technology software and associated equipment, and the regional delivery and supply costs. Next slide, please. So statewide revenues per capita spent on library services is $48.59. Within Great River, that amount falls to $20.43. And again, in Morrison County, that falls to $15.43. This illustrates the efficiencies of having streamlined operations across the library system, and it also demonstrates the commitment of our board and staff to providing high-quality library access in the most cost-effective manner possible. Next slide, please. We'd like to thank our board members for their high levels of dedication and commitment to learning library system operations, and recognizing that library services are a core government function for all residents. It's been great to work with and get to know Mr. Casper over this last year. We appreciate his input and desire to learn more about the library systems and its operations. We want to thank you for your continued support of the library system and our services, and are happy to answer any questions that you have at this time.
Thank you.
I'd like to add to, one of our commissioners on our board wanted to make the point that this particular budget is a fairly stable budget for our system, and we recognize there's a lot of changes happening at state and federal levels. And I think earlier this year, this board talked about one of the impacts would be to Minitex potentially if federal funding went away. At this point, federal fiscal year 26 dollars are not allocated for library services. So should that continue to happen at the federal level, we would likely need to absorb some of that service level at the local level in order to maintain things like interlibrary loan or electronic databases for our patrons. So we're hopeful that this budget provides that platform for whatever might come. And that's a hard thing to predict when we're talking a year out, but we want to be prepared for that for our patrons because many of them rely on these services, especially in our rural areas where you just don't have a lot of options when you need resources.
Commissioners, any questions?
I have some questions, Mr. Chair, but I thought maybe somebody else would want to go first.
Well,
Comment?
no, just so you're aware, we've got word this week that our friend Karen is going to be exiting. And that's difficult to see because Karen does a great job. We're gonna miss you big time.
Yeah, thanks. I'll miss it too.
Thank you.
Commissioner Wincher?
All right, thank you, Mr. Chair. The reserves, now, again, the county or the library has dipped into reserves the last 3 to 5 years, they're stating, right? What dollar amount do we have in reserves right now? Is it not so much dollar amount, normally you should keep 3 months, 6 months, 60 years, you know what I'm saying? What do we have for this coming?
Our policy states that we have to have 3 months of reserves, and then excess reserves that we have right now are less than 1 month. So we are down to 3.92 months of reserves.
On that edge.
Yeah, and I think if you back up, I don't know if it's possible to back up to slide, let's see, the one before the pie chart. That's possible. It's the one that says 2026 budget for GRL. There's actually two forms of reserves in the budget, one-time money in the budget. The first one is that spend down plan that Amy mentioned. And then typically, this is a $10.5 million budget. So if we're doing a good job, we're going to have a little left at the end of the year. And 3% of 10 million is about 300,000 and change. So we take that roll forward at the end of the year and put it into the next year's budget. So you'll see that 2024 surplus carryover. That's actually leftover money from last year that we put into this budget year at the beginning of the process. We recognize that we want to roll that forward. It's a gamble because at some point that might not be that big, but it is a fairly large budget and it can absorb some shock, if that makes sense. The hard thing is 80% of it's personnel. So no matter what we do, it will impact services if we reduce the budget.
And one more, maybe I might have more, but when you brought up the federal and the state funds that may or may not be there, what dollar amount, and I kind of know this, but what dollar amount have we got in the previous years that we could lose?
The direct amount is about $7,000, which seems really small, right? But that goes to support Great Rivers operations as a hub within central Minnesota. So we are the place where the University of Minnesota delivers interlibrary loan, and we go to St. John's, St. Ben's, St. Cloud Tech College, St. Cloud State, and drop off and pick up. And that goes to our dock and then back down to the U. So if you need a book on beef cattle science that we don't have, you can get it within a couple of days. So the $7,000 isn't so much the impact, it's the ability for Minitex to do the main delivery down at the University of Minnesota. And over half of the federal funds for library service received for Minnesota go to Minitex to support services like that. So if people are expecting to get the beef cattle science book and the University of Minnesota or Minitex cannot deliver it, we're going to have to find a different way to get it, and that could cost us more money. So it's not direct.
What is Minitex now?
Oh, yeah. Rand, if you didn't know, Commissioner Wincher was on our board and was chair for many years, so we've worked together a long time. I appreciate the questions. Minitex is a state entity operating out of the University of Minnesota. It is kind of like the state library, except there is a state library. The state library provides administration of state grants. Minitex provides what other states often see as state library services. So they provide Electronic Library of Minnesota, they provide interlibrary loan, they provide training and support, they have the Minnesota Digital Library. So it's a lot of things that happen behind the scenes that people just assume are part of Great River Services, but they aren't actually services that we pay for. We receive them because we are a statewide partner. Minnesota has a really robust, efficient statewide system of lending. We don't have to think about whether or not the book is coming from Thief River Falls. I can't imagine negotiating those contracts again, like that was done in the 80s, where sharing was a cool idea, and now everybody is more territorial. And I think that hampers the ability to deliver services in a way that rural residents really need, because there is no way Great River can purchase every single book that every single person in Swanville wants to have. And it might not be a book, it might be an ebook, or it might be the school library's database. And so there's a lot of things that that federal funding supports.
Any other questions?
Great answers.
Thank you.
Those are-
Good questions.
Any questions? All right. Well, thank you.
All right, thank
The
you for
update.
your
We
support.
appreciate it very much and for everything you do.
Thank you. Have a good day.
You too. Thanks.
Just a real quick question here. Karen, excuse me.
That's
Thank
right.
you,
Go ahead,
Mr.
Bobby.
Chair. Was the budget flat last year? Is
No.
that correct?
The budget went up a little bit, but the county
Very
shares
slight.
stayed flat. Like, the county shares are about 70% of the revenue, and so when we're offsetting with those reserves, that's what's spending down that county share part of the budget. But this is actually a much flatter budget than a year ago. It's a lot of moving parts that make that happen. Some of it was state funding increased a couple of years ago.
Okay, I was aware of that, I just wanted you to
Yeah.
say that out loud for these.
Yeah, thanks. Yeah, there's a lot of pieces to this. If you have more questions, we're happy to talk about it.
Great. Thank you very much.
Thank you, ladies.
Have a great day. See you this evening.
Mr. Chair,
Yes, go ahead.
actually, the county's contributions to Great River reduced last year $3,751, so it was a reduction.
All right. Land Services Report. Good morning.
Good morning. I have a new employee to introduce to you before I get going on my report. This is our newest member of Land Services, Kayla Worm, and she is an appraiser for us. So her first day was yesterday. So, and I sprung it on her this morning that she's coming down here, so.
Lucky.
And you told her she has to have her speech ready?
I did, so hit it.
Okay.
So if I made sure, and you're from around here, we're in school, all those good things, where'd you all go?
I went to school in Foley for high school. Just moved to St. Cloud, started my adult life. The college, I went to University of Wisconsin, River Falls for agricultural business. And, yeah, I don't know what else you want to know.
Well, she worked in crop consulting,
Yep.
for insurance, so she's got some internship experience with ag background, so I think that's gonna serve her very well here.
Very good. Well, welcome aboard.
Yeah, welcome.
you.
Hope it goes well.
All right, and then I have got for you to consider the interim use permit request for Kevin and Carrie Dembowski. This is for a limited rural business, specifically to allow for a farm market and learning center. This was recommended for approval by the Planning Commission at their last meeting. This was also recommended with 5 conditions, and those conditions were that no customer parking shall occur within the road right-of-way. The septic system serving the shed, school, and market shall be sized for the commercial use and approved by the Morrison County Land Services prior to classes being offered. And then within 1 year of business operation, testing of the waste strength shall occur If additional treatment is required, this shall be accommodated. 3, all applicable state and county licensing for the use must be maintained. 4, the hours of operation for classes shall be between 7 a.m. and 5 p.m. And finally, 5, the interim use permit is valid until Carrie Dembowski or Daisy Dembowski no longer own the property.
Very good. Thank
I
you.
make a motion to accept.
Motion by Commissioner Casper,
I'll second it.
second by Commissioner Moran. Discussion?
Mr. Chair.
Mr. Winter?
We attended, or I should say I was there and the other commissioners, and it was well vetted again. It's just, and again, I give this applicant credit for what they're trying to, do in the community. It's a small business. I think they want to teach people how to can and stuff
Yes.
like that. It's like, okay. So I was impressed, so yeah, I'm all be in favor of this.
Very good. Thank you, Commissioner Winter. Anything else, gentlemen?
Yeah, I think it's just complimentary. It's a beautiful little family business there. I'm excited for them.
Anything else? Hearing none? Do you have a motion and a second?
Yeah, we do.
We got a motion and a second. No discussion. All in favor signify by saying aye.
Aye.
Opposed? Motion carried.
All right, thank you, Mr. Chair, that's all I
Thank you,
have.
Amy.
Have a great day.
Thank you.
Thanks, you too.
Thank you.
Thanks, Kayla.
That's not on here. I think it's too early yet. Get 3 weeks. Good morning.
Good
Please
morning,
state your name for
Mr.
the record,
Chair,
please.
Commissioners. Nathan Bertram, Health and Human Services Director.
Lori Verolson, Executive Director, Central Minnesota Council on Aging.
Good morning.
Good morning. So I am here with Lori and Minnesota Council on Aging. Annually, there's a small part of our budget that goes to Central Minnesota Council on Aging. And so with that today, we have Lori here to go over kind of some of the details of what services they provide our Morrison County residents, and I will let her cover that.
All right. Do you have the PowerPoint?
Oh, yes.
Is it this or it's a PowerPoint?
No, it's a
Okay,
PowerPoint.
then I'll just need a minute.
Okay.
I think I sent it last week.
That's okay. I do have a flash stick too.
I can try to find it too if that's quicker.
Just now? Okay.
Did you find it? I apologize for that.
No problem. Not at all.
Now we're doing a scan to make sure the attachment's safe. Just a moment.
All right. All right, so Central Minnesota Council on Aging, we are a nonprofit organization. I always think of ourselves as kind of quasi-governmental. Our board is all representative of 15 county commissioners from our 14-county area, and Commissioner Casper serves on our board. And in the nation, so in 65, the Johnson administration enacted the Older Americans Act, and so across the nation, every county in the nation is covered by an area agency on aging. In Minnesota, this Minnesota Board on Aging, which is a division under Department of Health and Human Services, serves as the state unit on aging, and they designate the area agencies on aging. So in Minnesota, we have 6 regional area agencies on aging, and in 1 tribal AAA that covers the 11 tribes in Minnesota. So in our 14 counties, our office is in St. Cloud, and then we have staff that are located throughout our region. In our 14 county area, we're home of about 183,000 individuals over 60 plus. So if you go to the next slide, our core services is that we operate the senior linkage line on. We're contracted with the state of Minnesota to operate the senior linkage line in our region. So with that, we do a combination of providing individuals assistance over the phone, helping them evaluate their situation and get connected to services. And then we also have social workers that can go out and meet individuals in their own homes and at community locations. So, for example, here at the hospital, we have our senior linkage outreach specialist is here once a month helping individuals that the hospital has set up the appointments for. And then we also, like I said, in the homes as well. And then we fund the Older Americans Act services and grants and contracts to providers. So once a year, our board and advisory looks at what are the services that we can award funding to under the Older Americans Act, and they go through a prioritization process to really determine, with the limited dollars that we have, what are the core services that we want to seek applications and provide funding to. And then we also work with communities on development of new services and supports, once again, all focused on helping older adults remain in their own homes. So if you go to the next slide, I just have a couple slides on demographics. So the first one is in Minnesota right now, we're the home of over 1 million older adults, and by 2030, they'll reach 1.3 million. So we currently now have more individuals over age 60 than we do school-age children, and that's the first time in history. And so that trending, you're seeing that play out with both additional resources available of older adults that are entering retirement age and are giving back to the community through volunteerism and mentorship, but you're also seeing it with the growth and need of services and supports. So if you go to the next slide, you'll see here that in the state itself, just over 22% of our state is over age 65 right now. Morrison County is higher at almost 28% of residents in Morrison County are over the age of 60, and just over 2% are over the age of 85. And that 85 is an important period because that tends to be often when individuals start to access formal supports and services. So I am pretty sure, like, if you look at the county caseloads, you're going to have many individuals that are over age 85 on that. So if you turn to the next slide, living alone in Minnesota, 1 in 4 individuals over age 60 live alone. In Morrison County, you're a little bit higher at 25.7%, so fairly consistent with the rest of the state. We do see that the proportion of individuals living alone advances with age, and women in particular over age 75, 43% of them live alone. If you go to the next slide, disabilities. This chart represents individuals with disabilities. What we do know is that many older adults are dealing with several disabilities at one time. The state average is 30% that are of 65 plus population are living with disabilities. In Morrison County, you're at 32.5%. Next slide. And then with poverty, I'm sure you're well aware that in Morrison County, we have a higher level of individuals that are below the poverty threshold. So statewide, we see 7.6%. Morrison County, you're at 10.2% of individuals that are below the poverty threshold. And if you go to the next slide, we know that majority of older adults want to remain in their own homes. Only 4.5% of individuals live in assisted livings, which costs about $45,000 a year currently, and 2.4% live in nursing homes at a cost of about $141,000 a year. Our agency, along with one of the other area agencies on aging, we do all the pre-admission screens for nursing home authorizations in the state. So we do about 61,000 pre-admission screens a year. And 72% of those individuals are planning on staying in the nursing home for under 30 days. So, when we look at nursing home level of care, there's a lot of individuals that move into the nursing home, transition from the ER or hospital to the nursing home for rehab with the intent of moving back home. But in order to do so, they need to have the right mix of support services in place for them to do that. And really that is where the Older Americans Act services come in. So if you go to the next slide, what you'll see, this is information from last year. So we had 24 contracts last year with service providers throughout our 14-county area, and we allocated out $4.6 million of. This is mainly federal Older Americans Act funding. There is some state nutrition dollars in there as well, reaching just over 24,000 older adults in our 14-county area. And that was with services really to keep older adults in their own homes. So Older Americans Act services are targeted to lower-income, frail individuals residing in their own homes, as well as family caregivers. And the unique thing about the Older Americans Act services is that they're done on donation basis. So, for example, if somebody receives a home-delivered meal, they'll be informed what the full cost of that home-delivered meal is, and they'll be provided with information about what the recommended donation is. But whether that individual contributes or not, they're still provided services through the Older Americans Act. So there's no means testing. So I always think of the Older Americans Act as kind of that safety net. We're trying to reach individuals that aren't yet on Medicaid and on waivered services, although some of the individuals that are being served are. So we're not trying to serve all 183,000 seniors in our region. We're really trying to service those that are lower income and trying to keep them off of public assistance by having some basic safety net services available to them. So if you go to the next slide, you'll see that last year, and I'm sorry, that says Pine County, I didn't flip that, but the data is for Morrison County, so I do apologize. So in Morrison County last year, $363,696 was provided for services specifically in Morrison County. So when individuals receive services, there is an intake process, so we're able to discern where they're coming from in the services they're receiving. So this represents about 8.1% of our overall Older Americans Act funding. So when I said we allocated out $4.6 million, 8.1% came for services to older adults in Morrison County. In Morrison County itself represents about 5.2% of our 60-plus region. So the next slide, you'll see this is specifically, once again, for services in Morrison County last year. So with that $100,000, you'll see that with senior linkage, we served, we provided just over 794 units of options counseling to individuals. That's the only thing that we do directly. Our contract for the assisted transportation chore homemaker was with Horizon Health with the Faith in Action program. So 1,258 rides. Those are primarily rides provided by volunteers that Horizon Faith in Action has recruited. And then they're primarily taking those to doctor's appointments, social service visits, grocery shopping assistance, that type of thing. Chore services, 137 hours of chore. That would be things like if they needed a ramp built, or if they needed some minor home repair done, like a grab rail installed in a bathroom. It could be some yard work as well. And then homemaking services, 1,114 hours of homemaking services. We did provide Horizon Faith in Action additional dollars last year for homemaking. They had a high number of individuals that had been being served under with veterans benefits, and they weren't receiving nursing level care. And so because of that, they became no longer eligible for the homemaker under the veterans benefits. So then Horizon Health started to serve them under our Older Americans Act. So this would be things such as doing laundry, maybe doing some meal prep, doing light house cleaning. Those types of services would be classified under there. And then the evidence-based health promotion, 45 individuals received evidence-based health promotion. Horizon Health is doing a PEARLS program, which is an evidence-based program that is really focused on the individuals with depression or anxiety. And then a number of individuals actually from Morrison County have attended classes at Whitney Senior Center in St. Cloud for chronic disease self-management, matter balance, falls prevention, and chronic pain self-management classes. And then with congregate dining and home-delivered meals, you'll see that 1,626 congregate meals were provided. That would have been through Lutheran Social Services in Morrison County. We have the Pierce Senior Center, Little Falls Senior Center, both are congregate sites, and then in Randall and Motley. And then we have Lutheran Social Services that does traditional home-delivered meals, and then Catholic Charities, who has 2 frozen meal distribution sites. So with the traditional home-delivered meals, Lutheran Social Services is really reaching individuals that are at high nutritional risk, frail, and really aren't able to prepare their own meals. And then with Catholic Charities, they have 2 sites. One is at Pierce Fellowship Bible Church, and then at the Franciscan Sisters twice a month during the NAPS, Nutrition Assistance Program for Seniors. Those food commodity locations happen at those 2 locations. And then, so Catholic Charities then also brings frozen meals, so individuals can receive up to 25 frozen meals once a month at those 2 frozen meal distribution sites. So each month at each of those sites, they average about 500 meals that are being distributed. So when you look at the home-delivered meals, the 24,000 home-delivered meals, that's a combination of those through those frozen meal distribution sites and traditional home-delivered meals. And then you'll see the caregiver coaching support groups, education, that is being done through Horizon Health. And then the respite is 1,635 hours of respite that's primarily being done through Horizon Health through their adult daycare. And so what we do there is Horizon Health has a number of individuals through their adult day that are being served under the waiver and in some private pay. And there's always some individuals who really they don't qualify for the waiver, but they can't afford private pay, and that's when the Older Americans Act kind of fits in there. And then the legal assistance, the 186 hours of legal assistance is through Midman Legal Services, and they have a site out here once a month that they do as well. So that's a kind of a snapshot of the impact last year. We do know that, you know, last year was the sunsetting of our, we had, in addition to the federal Older Americans Act dollars, we also had ARPA dollars. So those dollars have sunsetted. So this year, it's right around $3 million that we're allocating out. So we have seen a decrease. We also, in addition to the sunsetting of the ARPA funds in 2025, there's a new intrastate funding formula that went into place, and I think I came and presented to the board about 2 years ago for that. That went into place now for the first time in January. And so the combination of the two, you know, we have seen, we had to reduce our in-home supported services for like chore, homemaker transportation by, you know, pretty substantially. Home-delivered meals across our region was, in congregate dining and home-delivered meals, was reduced by about 100,000 meals. So we did try to work with the state legislator this last session for some increased funding in the state funds. We did receive in 2026 allocation of 250,000 statewide. Currently, that nutrition allocation was just over 10 million for the biennium. So we do know that next year, as we're just starting to get our requests in from our providers, are due in August. Just in the state nutrition allocation as a comparative, we currently have $365,000 for state nutrition. We'll have $35,000 in addition to our federal funding. So we do know that we'll be needing to further target resources and hopefully be able to maintain the sites that we do have in place, but we'll need to further target who's being served at those sites. So our request to Morrison County in 2026 is a request of $3,131. Overall, through our 14-county area, we're asking for $62,630, and then we prorate that by each county by the 60-plus population. So that's how we do the formula. So with that, are there any questions that you may have?
Commissioners, any questions?
Yeah.
Mr.
Chair,
Moran.
How do people know that you're out there? How do they get a hold of you? Do they come to the county, or do they have to reach out to you, or?
Yep. So we do get a lot of requests that come through us through the senior linkage line, and then we connect those with the providers. But our Older Americans Act grantees that we have, you know, they really, you know, we work through local, local entities to do services. So, you know, they really work at getting the word out. We do assist with that. And then they also work very closely with the counties and with health plans as well. And once again, like I said, we're trying to, you know, really target those lower income individuals. That's one of the reasons why we started to hear from food shelves during COVID that they were seeing, 48% increase in older adults going to the food shelves. So that's why we started to partner with Catholic Charities to pilot doing food distribution locations in partnerships with food commodity locations to really target those lower income individuals. So, when our providers are going out, you know, they're really looking for individuals that meet those targeting criteria, which is important since there is the services are done on donations. Now, with that said, we do know with services, for example, like assisted transportation, you know, they're having a volunteer take them from one location to another. Those are often individuals that can't use public transportation systems. And so with those types of services, they may be serving individuals that are moderate income, but they're not able to use the formal systems that are out there. And especially, as you know, in these rural areas, you don't have the luxury of some of the rideshare programs and other services that are out here too. So it really is dependent upon the community being served.
Thank you.
Commissioner Wincher?
This may be for Nate or even Matt, this additional money of $3,100, where would that money be taken from? You know, do we have money for this? Two, do we know, like, is this the only dollar amount that we give every year, or is that added up on what we currently give?
Mr. Chair, Commissioner Wincher. So the dollars have, well, historically in my 2 years and then prior to that, have been in the Health and Human Services budget, and we kind of keep and hold that agreement in HHS. From memory, I think last year was pretty close to the same amount.
3,040, and it went up to 3,131. So, yeah, so historically, I've been with the agency for 30 years, and historically, the money has, the match required to draw down, so this is used to match our federal Older Americans Act dollars to be able to draw those down. So it's the administrative match portion. And historically, we have always gone to the counties for that match, and it's been relatively, I mean, it doesn't change very much year after year. And different counties handle it differently. Most take it from the Human Services, some take it from other, I don't know if it's a general county board fund, I'm not sure, but I do know it happens a little bit differently into different counties.
And Mr. Chair.
Yes, Nate.
If I might add, I mean, Central Minnesota Council on Aging is kind of one of those key partners, certainly for our health, or human services team, which Aaron and Sarah in the back, who sit on that team. I think just kind of the crossover work that happens naturally with their intake team, adult protection, and some of our elderly waiver and care coordination services with the insurance plan. There's a lot of work that happens back and forth between the two agencies, and it's a really good partnership for Morrison County.
Mr. Casper?
Thank you, Mr. Chair. Question for Lori, and I don't know that you can, first off, I know that you run a tight ship. You folks do a great job. I've been privy to it, and thank you for that. Yeah, Lori, a while back, there was a situation of fraud, and I don't know that you can divulge, but there was a drop site for meals, and it wasn't happening. And when Central Minnesota Council on Aging tried to hold these people to account, they kind of vanished. I was wondering, is that investigation ongoing, or whatever became of that?
Yes, it is.
Okay,
It is.
thank you.
And we did, it's a situation where it was just over a month worth of services, and we were fortunately, with our site visits that we do, we were able to identify it very quickly.
Very good. Thank you, Lori. Thank you, Mr. Chair.
I just have a simple question, I guess. So if an individual is at home and needs extra help, they can call the senior linkage line? And then you put them in contact with someone else, or do your people go to their home and determine the needs that they need?
Sure. So, yes, so when someone calls the senior linkage line, then, you know, we have phone-based assistance that we do. If you call the 1-800 number, you could be routed anywhere in the state to any of the senior linkage, okay? And then if a person needs, because if they have a complex situation, if they need that face-to-face, then they're transferred to it's routed to the local AAA then, and then we go out and we'll do an in-home visit. If we are able to, with the system that we are able to determine if they already have either a health plan case manager or a county case manager. And if that's the case, then we'll connect with that individual and let them know, especially, for example, if they've been discharged from the hospital to a nursing home or home, we're able to, that's one of the things with the pre-admission screen, we're able to notify, and then so we'll contact with their case manager and say there's been an event, they were in the hospital, they're going to the nursing home, they plan on being there for 60 days, and so that they can start working on that plan right away. And then we work with the ones that don't have that other case management available.
Very
Yeah.
good, yeah, because that's huge. I know when my mom got sick, you don't know where to go.
Right.
And you make one phone call, and then they at least can direct you what you should do, or, because that's a scary situation. And then the statistics that you said, I believe you said females over 70 or 40% alone?
43% live alone.
Live alone. Oh, that's scary.
Yeah,
And-
careful, Mike.
Yeah,
And they may not have their, often it's the females that are the caregivers too. So, they're, when they're in need of care, they don't necessarily have the same level of support systems available, so. And that's where programs, that, like I said, with the Older Americans Act, they're really trying to assist those individuals with some, basic beginning low-end supports, and individuals will often have that supplemented with more formal home care and other services as well. But there's also such a workforce shortage too, that individuals may not be able to obtain the level of formal paid services, and that's where these kind of supplement in as well.
very good, yeah. And then, well, you mentioned one other thing, that was, first time in history that there's more over 60 than school-aged children? Wow.
Yeah. And as you recall, you're Morrison County, you're higher than the state, so I think Cass in our region is the highest at like 33%. So, you guys are starting to see the impacts that some of the rest of the state will notice in a few years, but it's,
Mr. Chair, families are not as big as they used to be, and
Yeah.
the baby boomers are getting older.
Yeah, yeah.
yep.
But I just want to thank you for the work you do.
Thank you.
I'd like to see how much money a dollar is saved by the work that you do, because, nursing homes are $10,000-$12,000 a month. And as long as you can keep them in their home, they're happier, and, well, most of them are probably happier. Some people like the camaraderie at the homes, but
Mr. Chair,
Appreciate everything you do.
you're requesting us to,
yes,
for today, so are we gonna take a vote on this?
yes. So I'd need a motion and a second.
I'll make a motion to approve the request for the CMCOA. For the
Motion made by Commissioner Winter, second by Commissioner Casper. This will be our discussions. Hearing none, this will be a roll call. Commissioner Casper,
Aye.
Commissioner Winter,
Aye.
Commissioner Moran,
Aye.
myself, Commissioner Lemire is aye, Commissioner Blaine.
Aye.
Motion carried.
Thank you.
Thank you for what you do.
Thank you.
Appreciate it very much.
That's good work.
Thank you, Nate.
Yeah,
Thank you, Nate.
Thank you, Nate.
Was I talking too much, Randy? Is that, you wanted to get the
Thanks,
ball
Aaron and
on the
Sarah.
roll? All right, next up before us, we have Morrison County Veteran Service Offices Annual Report.
Yeah.
I thought you thought I was talking too much.
Not at all.
I'm just kidding. Good morning.
Good morning, Mr. Commissioner, Mr. Chair and Commissioners. Good morning.
Good morning.
Well, my name is Christina Vonberg. I go by Chris, and I would like to say this is my third year in the position come August of this year. And so still feel honored. I love helping the veterans, their families, and all the kids. So today I ran a few numbers, maybe not as detailed as Lori. Lori has a lot of numbers. But some of them actually are our veterans who are in the nursing homes, who are at the senior level. So I'd like to say that the Morrison County Veteran Service Office actually utilizes the resources, and we partner with many different agencies to take care of the veterans, their families, and every dependent that they have. And so some of the programs she mentioned, Lutheran Social Services, food, the cost to have a veteran in a nursing home, $141,000 per veteran. These are benefits that in the end, the VA or the Minnesota Department of Veteran Services also has programs that alleviate that cost to the county and take responsibility for the veterans that are enrolled in their programs. So that was really nice to hear that she had some of those numbers that I had no idea how much
Yeah.
it costs to live in a nursing home.
That's something.
It was pretty fantastic, actually. So I'd like to start out with thank you for everything you've done for the Veterans Office. And our first slide is outreach. And so how do we get more people? How do we generate veterans? It's word of mouth. It's making every veteran feel valued. We use the radio and the community clubs in the entire county. And we don't just use the veterans organizations. We reach out to the non-veteran organizations. They want briefings like the Lions Club, the Exchange Club. They said, what do you do for veterans? We want to know. So the way to get people to send a widow our way or send a veteran our way is just outreach and education and awareness. So I felt that 3 years ago when I started this is put your finger on the pulse of the community, see who's doing what, and see who has the resources to find the new people that we could serve in Morrison County. So that's working very well, actually. And advertising, that's minor, but it's word of mouth, and it's connecting and creating relationships. Events that we do that are annual every year. We do a couple retirement seminars at Camp Ripley, and that pulls about 200 people. So that's 400 people, 2 events, and they bring, maybe they bring a significant other, maybe they bring a new veteran. And so we're, again, making personal contact. We have about 20 different vendors at these events, and so our office lines that up. The veterans learn what benefits they have and what they didn't know, because nobody knows what to ask if you don't know the question. And so it's presented every benefit that potentially could be for the veterans. It's going very well. We did an annual pontoon ride, all with volunteers. The cost is actually nothing. And so we find I don't want to say shut-ins, but I want to say the veterans who don't go to the clubs, the veterans who are in wheelchairs. And I have community members who say, I'll pick up the veterans in the wheelchairs and drive them out there. And last year we had 9 pontoons. They all had American flags. And the veterans wheelchaired or walkered or walked onto the pontoons. And we wanted to make them feel valued. We wanted to get them out. Like I said, these are not the ones that go to all the clubs. They don't have a lot of friends. But we found them because we're either talking to a relative, we're visiting them, we pop into nursing homes, we see them everywhere. And what we want to encourage by doing that is veterans speaking with other veterans. And so, is there a coffee club in Little Falls for veterans? No. Is that something in our future we would like to see? I think that would be something we should encourage each county. So in 2026, we may say, this is something we'd like to implement. You're not at a bar, you're drinking coffee, and you're connecting with other veterans to find out what they're doing, how are they getting their nursing home care, what do they go to the VA for? These are just people talking to people, and they feel very comfortable. So that's what we get out of the pontoon ride, is helping more veterans. Information booths at various events. We did 16 last year on Camp Ripley alone. So Camp Ripley has a great relationship with Morrison County, and they provide a whole bunch of veterans that need service. And so some are young veterans, maybe 19 years old, and some are veterans at Camp Ripley for the briefings that go up to age 60, because you can stay in the military till you're 60 years old, and they have no idea that anything they did in the military could potentially equate to VA benefits, because if you got hurt or you were exposed to toxins or something happened when you're in the military, unfortunately, now later when you're out of the military or you're still in, you can put in for some VA services. And most of these soldiers have deployed, and so that means 1 year. We have soldiers with 8 deployments. That's 8 years of not being at home. And they sometimes have no idea what benefits they're eligible for. So when we go to the military events at Ripley, I think that's a big payoff. And they're talking to each other at drill weekend, on annual training, and when they deploy. So we're getting them before they lose out on benefits that they've earned. So I think this is great how we created that relationship with Camp Ripley. Okay, education and awareness. I threw that on there because we do a few things besides the pontoon ride. We do the Month of the Military Child. This year we reached 300 children. They had the t-shirts. The moms and the dads are proud. They want their kids to be proud of their parents as well. And this year we also did the Month of the Military Spouse. Thank you very much for whomever mentioned that. I forgot.
Shmaran.
Thank you. Appreciate that. So everything we can do for education and awareness is going to pull more customers into Morrison County. And we are a public service to every veteran in Morrison County. And so that's why I think outreach is very important. You can't just not do outreach, because if you just expect the veterans to come, they won't come. So I feel like this is kind of something we're really focused on, and we're going to continue to do some new initiatives on that. Okay, next slide. All right, let's see here. Financial assistance for veterans. I was very proud of this for our office in 2024. When I first started, as you know, you aren't accredited for a year. You don't know all the programs. You're in the upscale, you're learning. Everything is a curve. So as I began to learn, and as Luann began to teach me, and as Jim thought about transitioning to a new section, we, last year, got, I received absolutely nothing. We do paperwork. So the veterans received $233,000 in change for what we call special needs grant. And actually, they're called Veterans Relief Grants. They've just changed the name. And this is a Minnesota Department of Veterans Affairs program. It is amazing. It's a secret that I asked the Minnesota Department of Veterans Affairs, how do you advertise? They said, we put it in the VA newsletter. How many veterans really read the VA newsletter? They get it in the mail or on email, and they skim right through it, and they miss things that are a benefit for them. So if anyone has any active duty, like 1 year in Vietnam, like 1 year in the Korean War, like deployments, like active duty, and the military has a rule, if it's after 1980, you gotta have 2 years or a deployment. And these veterans are finding out about the program, and it is helping people live in their houses longer. It is a grant program for the 3 things that you see listed: health, safety, and financial ruin. So here's a good example. I was talking with someone, they said, my dad's a veteran, he lives in Morrison County. I just want you to understand the capacity it does to help people. And they said, he has a lawyer, and he's gonna do a claim. I said, why does he have a lawyer? Those are what we call claim sharks, because you have to pay a lawyer. And I said, why don't you send your dad over here to the Morrison County office? They did. This is a Camp Lejeune veteran who I found out has some sort of cancer that fell under the Camp Lejeune water contamination cancer. I said, what are you doing? Why are you paying someone? Well, I don't know. I thought that's how I was supposed to do it. I said, no, sir, that is not how you're supposed to do it. I said, however you want to do it, you can choose them or us. And in the end, he said, I want to work with you guys. So he had, unfortunately, $20,000 of Coburn Cancer Center bills he couldn't pay for. He was going backwards in his bills, and he didn't have a good job, like a dollar store, Walgreens, something type job like that, him and his spouse. And I kept drilling him down. I said, okay, you're in the Marines. You got the cancer. This is an easy claim. And it was funny because on his military paperwork, it didn't say Camp Lejeune anywhere. And this gentleman says, oh, I'm sure I was in Camp Lejeune. And I said, oh, okay. And in the end, I looked at him, and as he was speaking to me, he had a tattoo on his arm. And I said, are you sure you don't have an award that says Camp Lejeune, a travel order, something? And he says, nope. I was there a year. And I said, what's the tattoo on your arm, sir? And he said, well, that's my unit insignia from Camp Lejeune. So I took a picture of this gentleman. I put it in with his packet. And in the end, we did a VA claim for him. He is 100% service-connected disabled for his cancer, so he can get in front of it. They gave them $15,000 to pay back his Coburn's Cancer Center bills, and we enrolled him in VA healthcare. And do you know how fantastic this was? It completely changed this gentleman's life, him and his wife. Yeah. And if something happens to people like this, their widows will now receive benefits. If they're 100%, which unfortunately happens to quite a few people, then their widow receives some sort of what they call DIC. It's called Dependent Indemnity Compensation. So as a whole, we take each individual veteran and we see what we can do for them. And it might be a little digging, but this grant right here, this has helped all these people with roofs, windows, decks. If your deck is rotten and you're going to fall through it, this is a health hazard. So we've been using this, and I want you to notice, Matt asked me, why did you use these counties, Chris? And I said, well, these counties have 3 people in their office. Their veteran count is very similar to our veteran count, and the population is similar. And so Minnesota Department of Veterans Affairs puts in all these numbers, and I'd like to point out that Morrison County did that $233,000 and change, and I compared them to the other counties. People are coming in at the end of the year with $14,000. And I said, how come other veterans offices aren't using this program? And I heard from a couple different offices, and they said, it's too hard. I said, no, it's not too hard. You got to make it easy for the veterans and make them feel valued. So I think that's why the success for Morrison County for this, we took a different approach. This is not because you can't do something. It's a benefit that you're eligible for because you earned. And so I just like to point that out. I was very happy. And then the number underneath with that 188,000 and change, that is, you can thank every organization in Morrison County that has done something. That could be your VFWs, your Legion, your Yellow Ribbons, Wooden Hearts. These people deliver bedroom sets with full bedroom sets, mattress to the veterans who are coming out of homelessness. And so when we have a veteran who has homelessness, I use these organizations to food, lodging, money, so they can pay their bills, and they have a whole new life created for them. And so I just want to say, it's amazing that the resources we have that don't come from the county, that the veteran organizations still want to help. So that's where those numbers come from, and I feel like that's one of our big wins last year. Next slide. Okay. Okay, let's talk about claims and monthly for veterans and their dependents. So if you look at the bottom, huge contributing factors. PACT Act was that promise to address comprehensive toxins that started, I think it was August 10th. As a matter of fact, I know it was August 10th, 2022. And that changed the way a veteran service office is. So instead of not having enough veterans to service, which I think outreach is huge, the PACT Act created an opportunity for hundreds of thousands of veterans to come and say, hey, I was in the service 20 years ago, 50 years ago. I want to do a claim. I want an increase. And a lot of veterans never put in a claim because they didn't know they could. And so this PACT Act has been advertised by the VA, and you see billboards and you see a lot of stuff. So that has increased numbers across the board for veteran service offices. And again, I use the same counties that have similar staff, similar veterans numbers and populations. And everything is an upload system. So after we work with veterans, we figure out what kind of medical conditions they have, if it's burial, if it's education, if it's grants, whatever it may be. We had 800 plus claims last year out of our office, and I compared that to the others. And I thought, ooh, Douglas County, Todd County is doing very well. But again, it's the 14% of population that we have of veterans and families in Morrison County. So we have a lot of people we could service, and we sure did try. And I think it's going very well. And if I could compare it to this year because of the changes we've made, I'd like to say we are working together, and we've already, I believe, since July of last year, if you were to count January to July, last year, 2024, January to July, 2025, we are serving the veterans. Even though Nick in his position is still new and not fully accredited, we're working as a really great team for the county. So I think we're helping a lot of veterans, and the numbers show it, so I feel very happy. I'd like to point out that the Minnesota National Guard Retirement Services kind of folded last year. I know that sounds weird, but they didn't replace the person that left. So guess what we have in our backyard? Camp Ripley. And when the veterans are approaching age 59 or 60, depending on how many deployments they did, they said, hey, I need to do my retirement packet. And most veteran offices are saying, that's not our job. I'm like, might not be my job, but you're in the county, and you're a veteran, and you probably deployed, or you did your guard time, reserve time, guard time, any branch. However, it's a pretty easy packet if you actually studied it. Couple documents, gather a few things, request things online, and serve the veterans. So then they would be receiving their retirement at age 59 or 60. Everyone's different. Questions on that? All right. I mentioned the enhanced relationship. I really enjoy having Camp Ripley in our backyard. They're a very good resource. And in the end, I can talk about a lot of things, but the economic impact is what, when I worked at Camp Ripley, the economic impact is what General Cruz and Colonel St. Saver would come to the communities and share. This is how much we pay people. This is how much they spend in the community. And what does it really do? And according to the state of Minnesota, they have $4.1 billion. And I know we don't care about the state, so I whittled that down and said $32 million. The average income and the Morrison County veterans that we serve. We can easily account for the 70% to 100% veterans. We know how much they make, and we know we're tracking them because they have benefits that are different than those from 10 to 60%. And so we averaged that out and went to the low end. But this counts when you have nursing home care covered at $141,000 per person. You have open heart surgery covered. we had 2 people that received back pay because they did not get any, 25 years the VA went backwards because they put a big stamp that said denied on their veteran, and they were Vietnam veterans and they passed away. So we helped the widows, but they should have been receiving money from when their veteran passed away in like 2003. And I thought to myself, that was a long time ago. So we've recently been digging in and helping those people that didn't know they could have benefits because of, unfortunately, a death occurred, and their veteran should have got the benefits. So we're taking a little extra time helping the people who don't know what they deserve. So that's where our 32 million comes from, but it's a combination. Just an example, one student for a 100% disabled veteran, if they chose to go to college, that is $55,000 per student under what they call a GI Bill, Chapter 35. Because if you're a parent and you have a student, and they're still of that age, under age 26, they too receive benefits because of the disability of their parent, whoever was the veteran. So I just couldn't believe it when I looked at it. And $55,000 is just one benefit. There's more that goes with that, and that's for a dependent or a spouse. And so we are helping, we never turn away a benefit. We do, one of my favorites is, help me, what is that called? As we get older, the VA can say, we would like to pay your spouse or your child to help you. And it's called the Caregivers Program. And so the Caregivers Program is something, if you're not extreme and you're not ready to go to the nursing home, a family member could put in a packet. Again, this is another packet that we would do. And they receive extra dollars to take care of their family member. And so the VA doctor signs off on it. And these people are older, so they're not able to do their own paperwork. So we do everything for them. We get them to call their doctor. Doctor signs off on a document. Maybe they get a ramp built. Maybe they get a nurse to come to their house. Maybe they get extra dollars because their veteran may not be able to cook, drive, bathe. There's a series of items. So when we look at that, every day is a new day in our office. It goes from children's benefits to elderly benefits to the veteran receiving benefits. And our homeless number went down a lot. Last year, I think at the end of the year, we might have had one that we were working with, and we work with OASIS and MACV, which stands for Minnesota, what is that one? Minnesota, I can do this, Assistance Council for Veterans. And they cover back to house payments, utility bills. They get them lined up for an apartment. They may pay 3 months rent. So that money doesn't come from Morrison County, but we know where to go get it to stand up our veterans so they're not homeless. And with that said, if they've never done a claim, my job and our job in the office is to look at maybe what we could Service Connect so they could have money to pay rent and not be homeless. And that's that long process that may take a year. That might take a year and a half. But in the meantime, we have to figure out how to sustain that person so they're not homeless anymore. And so I think that's a huge win for working with other organizations in the county. And we do Lutheran Social Services, Catholic Charities. We have food coming in, believe it or not, from the Brainerd Elks. If we have people, we go outside the county and they want to help veterans. So every veteran who needs something, we figure out what that resource is and we try to help them. You can kind of see all the other stuff. And by doing all this too, it takes away from the other county programs. So maybe Health and Human Services doesn't have to pay for somebody to live in a nursing home because they're a veteran. And so there's a veterans home in every city that has a contract with the VA. And if a veteran, is 70% or greater, they will assume the entire payment for nursing care. And at $141,000, they still continue to receive their disability payment simultaneously, so their spouse could live in the house, still pay their bills, and everything has been going up, so I'm not gonna say that's a ton of money for them, but it's a help so they can stay in their house with Social Security and all the other things combined. So I really love working with the different organizations, and so does everyone in our office. At this time, I believe this could be do you have any questions? I didn't wanna take too long.
Commissioners, any questions? Commissioner Moran?
I just have one comment. The graphs are great. It's obvious that you and the guys go above and beyond to provide these services, and just thank you. That's great.
Anything else, gentlemen? I just want to say thank you too. These numbers are outstanding. It'd be nice to know how, for every dollar we spend, what you bring back to the community too. That'd be I bet we'd be really surprised.
Would this be a return on investment question?
Yes.
I don't know if Matt wants me to say it.
Yes, ma'am.
58-1 is what we did on the return on investment. Because, I'm sorry, I didn't know if I should say that or not. I took it out of a slide because, I don't want to toot our horn, but do I want to service the veterans? Heck yeah, I want to service the veterans, and I want them to think that this is a valued asset they have at Morrison County. And so we encourage everyone to come, whatever the need may be, we will help them.
Yeah, thank you, and make sure you thank the other gentlemen,
The team.
That's in the work, the team.
Yeah.
For the work that they do. We appreciate it very much.
And if you know of
How's
a
the new guy
veteran,
doing?
new guy's doing awesome.
Yeah, he's doing
I call him research and development. So he's a digger. So when we have someone come in, they say, my veteran was in Colorado and they were a surveyor and they were exposed to the same Agent Orange that the people in Vietnam had. I'm like, really? You're gonna need to show me a few articles. You're gonna need to show me some research. So Nick has been researching, and we are service connecting veterans who, because of their MOS, which is their job, military occupational specialty, no matter where they were, we're like, how can we help this widow or the veteran? And we're doing extra research, so research and development is doing great.
Good.
He's almost all accredited. I think his last class that they have scheduled may be November, because we have to wait till they schedule.
Sure.
But we're all attending the training too, and that is one thing that we're changing this year in 2025, more time to attend training. And when we go to training, we learn more resources to help the veterans. And last year, it was a little tough to do that because we had a lot of veterans and we needed to service any needs that they had, and deadlines were approaching. So
Sure.
cut out some training last year. This year, we are learning a lot, so it's great.
Awesome. Well, thank you so much.
And if anyone has a veteran, I want to share with you, we do one little baby grant a year. If you have a veteran that you know and they need to be helped with anything and they come in the door to the office, some of our little marketing money bought cups. You only get them if you come in the office.
You get a cup?
He works here, he comes in the office all the
Yeah,
time.
I wanted to take care of him, but he already took care of himself, so.
Yeah. Well, thank you for everything you do. Any more questions?
Mr. Casper?
Yes, thank you, Mr. Chair. Chris, thank you for doing this. These men and women, you guys included, you're heroes in our eyes. And we thank you for what you've done for our country. It doesn't go unnoticed. Thank you very much. The other question is, this is a little bit of a side, but where do you go for this pontoon ride?
Blanchard Dam, because the wheelchairs can get right on the pontoons. It's an easier, and so one of the local realtors said, well, I sat in a meeting a couple years ago at Mississippi Connection. She said, do you mind if I call all my friends on the south side of the dam? I said, absolutely not. That would be fantastic. So she lines up the pontoons, she gets everything together, and we have the veterans contact her, and it's kind of a great way. DAV organization is paying for lunch. There's no cost. Everybody, 3 or 4 of the pontoon drivers are veterans. So they pay for everything, and it's really great. We have some pictures. They stop at a sandbar. I don't live over there. So 9 pontoons lined up last year, American flags everywhere. We had one young gal who's a veteran, and she brought her child, and he was fishing with a fish, talking to the 99-year-old veteran in the wheelchair. I'm like, that was pretty cool.
That is cool.
Yeah, so it does a lot for the community just to know that veterans are everywhere. So outreach is important.
Yes, thank you so much. Keep up the good work.
Thank you for allowing us what we can do upstairs. Appreciate it.
Absolutely.
Thank you for being here.
Thank you, Mr. Chair.
You're welcome.
Have a great day, Chris.
Thank you very much. You guys too, please.
Thank you. Thank you.
Next on the agenda, Public Works. Uh-oh,
Uh-oh.
uh-oh.
Who did you hurt?
I hurt myself 20 years ago. Morning, Mr. Chair. Good morning, Commissioners. Tony Hennon, Morrison County Public Works Director.
Morning, Tony.
I've got one item of business for you this morning. As you're all aware, Public Works is always very aggressive, trying to find outside funding sources. Recently, the Federal Highway Administration released a grant opportunity that we'd like to pursue. It's called the FLAP Grant, or Federal Lands Access Program. Arkansas 35 Iris Road that goes by our landfill. It also goes by the Crane Meadows National Wildlife Refuge. And it's coming up in our construction program probably in the next 3 to 5 years. So we'd like to take this opportunity, apply for this grant to try to bring in some outside funding. So I'm here this morning just to request a resolution to support that grant application to try to secure that funding.
Commissioners?
Make a motion to approve.
Motion made Commissioner Blaine, second by
I could say.
Commissioner Casper. Discussion? I just want to say, we appreciate you reaching out for these grant opportunities. You've been very successful, and we appreciate that very much.
Absolutely, yeah, we have a great team between our engineering department and our environmental department and just all of our departments internally in Public Works, you know. I find some different opportunities and I kind of let them loose, and typically we've been successful. This is a very competitive grant opportunity. You know, there's only 5 million across the whole state over a 3-year period. So I figured we'd throw a dart at it and see if it sticks, and if it doesn't, it doesn't. Otherwise, it'll just come out of our normal CASA funds.
Absolutely. Any other discussion? Hearing none, all in favor of the motion signify by saying aye.
Aye.
Opposed? Motion carried.
That's all I have, gentlemen, unless there's anything else.
Thank you so much, Tony, for
See
being
you
here today.
Friday.
Yep, thank you. Yes, planning session Friday morning.
Look forward to it. Thanks, Tony. Have a great day. Thank you. Take care of that arm.
I might not be there. Administrators report.
Thank you, Mr. Chair. Got just 2 items for the board's consideration. First, I'll ask Kurt to come forward. And I believe we're going to ask to set some dates for Budget Committee.
That's great. Morning, Mr. Chair, morning, Commissioners.
Morning, Kurt.
So, budget season is in full swing. We're looking at department budgets for 2026. So I'm here today to schedule and get on the books a couple of budget committee meetings. I'm tentatively looking at August 19th and September 2nd. So those are your next 2, after next week's planning session, those are the next 2 planning sessions. So following
I'm sorry,
planning
Kurt,
session.
August 19th and
August
what?
19th and September 2nd. So
So
if
we
that,
just put down after the planning session, correct, Chairman?
correct, yeah.
Yes.
So
Is that good with everybody? Does that work for everyone?
Works for me.
All right. Gonna send an invite?
Yep, I'll send an invite and we'll probably notice it for 9 o'clock in case we get done early on the planning
Great.
session and we can go from there.
Perfect.
Perfect.
So that's all I have for you.
That's it?
Thank you,
Yeah.
Kurt.
Thanks,
Well,
Kurt.
Thank you, Kurt.
And Mr. Chair, my second item was I received a mailing this week from Congresswoman Fishbach's office, and so I'll just display this invite, if you will. So what they describe as something as mobile office hours. So the staffers from Congresswoman Fishbach's office will be in Little Falls Wednesday, August 13th, from 11 to 2 at the Carnegie Library. So the Congresswoman herself won't be here, but her staffers will. If anybody from the community would like to bring, issues at the federal level to bring back to the Congresswoman, so.
Very good.
Just sharing that, Mr. Chair, that's all I have.
Any questions on that, gentlemen? All right. Dates?
It'll go through August 3rd through August 16th.
And who's up next? Commissioner Casper.
Okay. So the 2 weeks here is 3rd through the 16th?
August 3rd, yep.
Okay. So Tuesday, the 5th of August, 8:30 planning session. And then 6 o'clock PC Bowl in the evening.
There's no PC that morning.
Oh, there isn't. That's been canceled?
Just Board of Adjustment.
Just
Those are
Board of
all
Adjustments.
Commissioner Lemire's.
Okay, okay. And then jumping down to the next week, we've got a Teams board meeting at 9 o'clock AM. The Mississippi Headwater, the Morrison Todd Wadena County Health Board has been canceled on the 13th, that Wednesday. And then I have a meeting on Friday, the 15th of August, 10 o'clock, Mississippi Headwater Board, Walker, Minnesota. That's all I have, Mr. Chair.
Very good. Commissioner Winter?
Got me covered.
Commissioner Moran?
Got me covered too.
I just gotta add Yellow Ribbon Committee meeting, 11th, 3:30. And that's all I got. Commissioner Blaine?
I have nothing to add.
Awesome. Anything else, gentlemen? Administrator LeBlanc?
No, Mr. Chair.
Hearing none, meeting adjourned.
Matt, what was the